World Tuberculosis Day 2023. The theme of World TB Day this year is Yes, we can end TB. A very positive theme, but we need to understand it is going to be our collective effort when it comes to elimination of this deadly disease, which virtually can affect any organ in our body. So मैं infectious disease physician हूँ, Dr. Ankita Baidya. I see lot of cases of tuberculosis which is affecting lungs, जो हमारे lungs को affect करता है, एब्डोमिनल टीबी जो हमारे पेट को अफेक्ट करता है, ब्रेन टीबी या मेनिंजल टीबी विच जो हमारे ब्रेन्स को अफेक्ट करता है, स्पाइनल टीबी जो हमारे वर्टिब्रल कॉलम को, हमारी रीढ़ की हड्डी को अफेक्ट करता है। टीबी वर्चुअली किसी भी ऑर्गन को अफेक्ट कर सकता है। सो ये जो बीमारी है इसके लिए हम सब का वी नीड टू हैव अ कलेक्टिव एफर्ट so that it is controlled, it is diagnosed properly, especially early diagnosis is important. इससे क्या होता है, if it is diagnosed on time correctly, that whether what regimen is there, doses are correct, treated adequately, तो पेशेंट का जो आउटकम होता है वो अच्छा होता है। साथ ही साथ जब हम इसकी बात करते हैं ट्यूबरक्लोसिस ट्रीटमेंट की, तो इसमें ये बहुत इम्पॉर्टेंट होता है कि हमें इनिशियल स्टेज पे कुछ टेस्ट हों जिससे हमें पता चल सके कि व्हाट काइंड ऑफ टीबी इट इज, ड्रग सेंसिटिव और ड्रग रेजिस्टेंट ट्यूबरक्लोसिस, एंड अकॉर्डिंगली द रेजिमेन इज डिसाइड. सो इट इज वेरी इंपॉर्टेंट दैट यू मीट द राइट एक्सपर्ट व्हेन इट कम्स टू ट्रीटमेंट ऑफ ट्यूबरक्लोसिस. टीबी इज नो लॉन्गर लिमिटेड only to poor people or only people with low socio-economic status or less amount of resources, or people, it is not only limited to involving just only your lungs, it can involve any organ in our body. So इसीलिए it is very important, as I told, that it can involve any organ in our body. So it is very important that the regimen selection, that the medicines, the drugs that are being selected for treatment of tuberculosis is according to the site of involvement and according to the national guidelines, that is RNTCPT guidelines, and also according to the international recommendations, so that it is treated adequately. If it is treated on time, diagnosed on time, that it is less infective to others, and as such we can control tuberculosis by taking a collective efforts, by meeting the right expert, by knowing what are the symptoms of TB and when you actually have to get it tested for TB. So most important, you need to remember if there is any chronic weight loss, if there is any chronic cough, evening rise of temperature is there, loss of appetite. So these are the 4 cardinal symptoms of TB, but it also depends upon which organ it is involving. So based on this, you meet the right expert and then what is the condition and how the further treatment has to be proceeded. If it is done properly, there is actually good outcome of the patients who suffer from tuberculosis. But yes, early diagnosis and early treatment is important, that yes, we can get rid of this infection. So thank you all, take care.